NSS unit of JSS Ayurveda Medical College, Mysore, jointly organizing a guest lecture on the eve of World Blood Donors Day on a topic, voluntary blood donation awareness. So World Blood Donors Day is celebrated on 14th June every year as the birth anniversary of Karl Landsteiner, as he was awarded the Nobel Prize for discovering ABO blood group system. It was first organized in 2005 by a joint initiative of WHO, International Federation of Red Cross, and the Red Crescent Societies, with the aim to raise global awareness of the need of safe blood and blood products for transfusion in a critical aspect of care and public health to save millions of lives. Now, it's a time to welcome the gathering, for which I request Dr. Subhash Chandra Bose, Professor HOD, Department of Roga Nidana. Sir, over to you.
Very good afternoon to one and all. First of all, I submit my humble pranamas to His Holiness. Welcome all. A warm welcome to all the chilled monsoon. June 14th of every year, the world is celebrating World Blood Donors Day. Since past 2 years, since many years, we are celebrating, we are observing this day. So not only as an awareness, along with the blood donation in our campus, but also outside the campus. JSS Medical College and Hospital, Dr. Pallavi Madam and his team, so constantly supporting us, constantly supporting and guiding us to mark this day as a part in the world observing the World's Blood Donors Day. As it is said by our colleague Dr. Rashmi Pujar, this is the day it has selected June 14th to remember the birthday of the scientist who has given a major contribution. So in this field, the blood products and safe transfusion, to respect with that, and also for that he has awarded with the Nobel Prize. Of course, so we are so many inventions. So till now it hasn't happened. So it is the time. To aware about the young bloods, and it is a continuous process too. So our every year, so 100 plus students, the young bloods, they're going to join. So not only giving an awareness to those, and also to the publics, the awareness is needed. So on this occasion of a World Blood Donors Day, I warm welcome to today's the guest speaker, Dr. Pallavi Madam, Associate Professor, JSS Medical College and Hospital. She's with us. She's going to share his experience, knowledge, and promoting the young blood in the donation of, and also it is a need of the hour in the present pandemic too. Once again, I welcome on behalf of the Department of Roga Nidana, on the Department of Kriya Sharira, and also the NSS unit, and on behalf of our JSS Ayurveda Medical College and Hospital, once again, heartily welcome Dr. Pallavi Madam on this occasion. And also, I welcome our Honorable Director, Dr. R. Mahesh Ji, who is the backbone for all the activities, such as academic activities. On this occasion, I also welcome our the Director, Medical Education Division, Shri R. Mahesh Ji, JSS Mahavidyapita. I welcome our the principal, Dr. Sarvesh Karji. So is a motive and guiding force. So in encouraging and also is to carry out such academic activities. On this occasion, I welcome our principal and medical superintendent, Dr. Sarvesh Karji, on this occasion. I welcome our Dean Academics, Dr. Rajesh Udupudi, on this occasion of World Blood Donors Day. Also, I welcome all our teaching faculties, Dr. Deepa Patil, Professor and Head of the Department of Kajikitsa. So she is instrumental, a key role in carrying out this program. I welcome Dr. Savita Iremet, Professor and Head of the Department of Kriya Sharira. So she is also joining, the department is joining hand in carrying out these activities. I welcome the Department of Kriya Sharira, so on this occasion. I welcome our the team, Roganidana team, Department of Roganidana team, Dr. Satish G.I., Dr. Matsudan, Dr. Nivel Joseph, Dr. Rashmi Pujar, so on this occasion. And also the team members of the Kriya Sharira, Dr. Savita Iremat, Dr. Meghana, Dr. Jyoti, Assistant Professor, so on this occasion. And also the NSS, our NSS Program Officer, Dr. Shashibindu, is also the instrumental in carrying out the activities in the outside the campus. So I welcome him on this occasion. And also I welcome our postgraduates and also our undergraduate students to aware in this, to take an awareness on this occasion. Once again, I welcome one and all on the occasion of World Blood Donors Day. Thank you one and all.
Thank you, sir. I welcome you also to this program. Now I request Dr. Savita Hiremet, HOD Professor, Department of Kriya Sharira, to introduce today's chief guest. Ma'am.
Good morning. It's my immense pleasure to introduce Dr. Pallavi. Dr. Pallavi P. is working as Associate Professor in the Division of Transfusion Medicine at JSS Medical College and Hospital, Mysuru. Madam pursued her postgraduate degree in pathology from Mysore Medical College. She obtained her fellowship in transfusion medicine from University of Minnesota, USA. She worked as the principal investigator in the research project of thalassemia from 2016 to 2020. She is a member of the Indian Academy of Pathology and Microbiology. Madam is also a member of International Society of Blood Transfusion. She has several publications in national and international journals. She has presented several papers and delivered guest lectures in various conferences and CMEs. Madam is interested in immunohematology, clinical transfusion therapy, and she has a special interest in thalassemia care. Madam received an International Fellowship Award from ICMR. We welcome you once again to this guest lecture program. Over to you, Madam.
Good morning, everyone. To begin with, I would like to thank the organizing committee, JSS Ayurveda Medical College, the principal, the medical superintendent, and also the organizing department, HODs, and all the staff involved in organizing this awareness program. This is mainly due to pandemic that we are not meeting in person. Otherwise, as sir told, we would have an awareness program, in-house awareness program, and also we used to conduct regularly the voluntary blood donation camp at JSSAMC Medical College. Seeking the blessings of His Holiness Jagat Guru Dr. Shri Shivratri Rajendra Mahaswamiji, and also Jagat Guru Shri Shivratri Deshikendra Swamiji. As we all know, today we are celebrating World Blood Donor Day. So every year on the June 14th, we celebrate International Voluntary World Blood Donor Day. It's mainly to celebrate the birth anniversary of Karl Landsteiner. As again stated earlier, Sir Karl Landsteiner is also known as father of blood transfusion, because the blood transfusion started 2 decades before, 200 years ago. So it was very difficult to have safe blood transfusion. Though it started with animal to animal transfusion, animal to human transfusion, human to human transfusion, not all transfusions were successful. It was very difficult. But Landsteiner sir made it easy by detecting the antigens present on the red cell. So he was the one who founded ABO blood group, and he helped us to make all the transfusions safer. So whatever we are having modern blood transfusion, the credit goes to Sir Karl Landsteiner. So that is why every year we are celebrating his birth anniversary as World Blood Donor Day. The main aim of World Blood Donor Day celebration is to raise global awareness of the need for safe blood. So we have to understand safe blood is very important, and hence we have to raise awareness for its availability of safe blood and blood products for transfusion, and also of the critical contribution made by voluntary unpaid blood donors towards the national healthcare system. So what is the importance of safe blood? When I say safe blood and blood products are very important, like they are critical aspect of care and public health. You name any modern healthcare treatment in this era, so they need support by blood transfusion. So that is why blood transfusion is saving millions of lives, and it is also improving the health and quality of life among many patients every day. The need for blood is universal. We all know blood is needed universally. But what we don't know is the access to blood is not available. It is not there. Access to blood is not universal. So that is why we are increasing the awareness about the need for blood donation. More and more voluntary blood donation will help us to give access to the safe blood, especially in developing countries like ours. We need blood. Universal access is still needed for us. So that is why everyone should join hands in creating this awareness, and they have to come forward to donate blood. World Blood Donor Day, again, the slogan, give blood and keep the world beating. What does it mean? What does it emphasize? So mainly by donating blood, you all are helping to save millions of lives. So life is saved, and that's how the world is also living. World is pulsating. That is the meaning of give blood and help the world to keep pulsating or the world beating. It's also a global call for more people all over the world to donate blood regularly and contribute to better health. First is thanking the donors, and also the people who have not yet started donation. There's a global call to join hands in regular blood donation. The specific objectives of this year campaign are to thank the regular voluntary blood donors in the world and create wider public awareness of the need for regular unpaid blood donation. So we'll know what is the importance of this regular unpaid blood donation in our further slides. And also to promote the community values of blood donation in enhancing community solidarity and social cohesion. And most importantly, as Sir said, young blood. It is mainly to encourage youth to embrace the humanitarian call to donate blood and inspire others to do so. We are celebrating the potential of youth as partners in promoting health. See, we all are fortunate that we are in the healthcare system, we are saving life. But for others, they need not be doctors or any healthcare staff to save the life. They can just donate blood and they can join hands in saving lives and promoting health. So that is why we are celebrating this World Blood Donor Day. An important aspect of 2021 campaign, that is World Blood Donor Day campaign, is it mainly focus on the youth, that is young population, adolescents and young people. Adolescents like when they are 17, 18 and young people within the age of 24. So they are mainly focused in this campaign. That's mainly because they are the potential source of blood. And they promote the spread of, by doing that, by encouraging more of youth, we are promoting the spread of healthy lifestyle. So what is happening is, once we tell the importance of need for blood, and also once we drag them into the blood donation pool, they will start developing healthy lifestyle. So knowing what are the pros and cons of blood donation and what is needed to donate blood, they will start developing healthy lifestyles. And also they will acquire greater awareness about one's own health. So they will start to take care of their health so that they can donate further. And they contribute to the development of all this awareness contribute to the development of a mature, responsible civic attitude. So that's how we are encouraging young people to develop a responsible culture in them, so that by developing healthy lifestyle, like not getting into bad habits of drug addicts or smoking or alcohol, or eating habits, eating good food. So those are the one which they develop, so that will also help them to develop their overall attitude towards the society. So we have to question why young people, why are they focused mainly in this campaign? What is their role in safe blood donation? What happens is, when we catch them when they are young, at their adolescent age or very young, by promoting good healthy habits in them, so they are supposed to have low risk of infection. Like whatever we screen or whatever infections are there by blood transfusion, the risk is very less among young people. So that's why we are encouraging more and more young people to donate blood. Another important aspect is, we have noted less disease which is related to age. Like you all know, as the age increases, the disease like diabetes, hypertension, obesity, and all those kind of diseases are more. So when you are young, when you are donating blood, these risk of diseases are less. So that's how you can donate blood regularly. So that's why we are mainly focusing on young generation. So what is the need for blood donation? Donating blood products is essential to community health, you all know. And the need for blood products is constant. You see everyone, some or the other time, they need blood. So there is constant need for the blood supply. And the other important thing is, there is no factory which manufactures blood. So we have no other means of getting blood. It's only by blood donation. You all coming forward and donating the blood. That's how we can procure the blood, collect the blood and give to the patient. So just a few statistical data, if we look into, the WHO estimates that blood donation by 1% of the population is generally the minimum needed to meet a nation's most basic requirement for blood. So if at least 1% of the population, whole population, comes forward and donates blood, and that is more than enough to maintain the basic requirement of our country. However, this habit is developed more in developed countries, but the developing countries are yet to inculcate that habit. And the average donation rate is 15 times lower in developing countries when compared to developed countries. So globally, more than 70 countries had a blood donation rate of less than 1%. That is 10 donations per 1,000 population. Now you can ask, how much blood do we need? So it is estimated that the world needs around 118 million units every year, and India itself needs 11 to 13 million units. And we are collecting around 11 millions, but again we are shortfall of 2 million units per year. So we have to make up this whatever we are short of. And Karnataka is collecting around 8.8 lakhs unit. That is according to 2019 and 2020 statistical data. So as I said, blood safety is a big issue. So we are behind safe blood. So blood is blood. Whether it is safe or not, what does it matter? So we should understand what do we mean by safe blood. Safe blood means when it is given, it is expected to benefit a patient without causing any adverse events. So adverse events related to blood and blood components transfusion, there are n number of adverse events related to blood transfusion. That is why when we are deciding or when we are giving blood transfusion, we have to always take these risk factors into account, and we have to see whether the blood transfusion is actually needed or not. So that's the rational blood transfusion. And the most important risk associated is the transmission of infections by blood, like HIV, hepatitis, syphilis, malaria. These are the important infections which can be transmitted by blood transfusion. Now, when we look into the risk of HIV, getting HIV infection by blood transfusion is 95 to 100%. So if infected blood is given to patient, there is 95 to 100% chance of getting the infection when compared to other routes, like whether if the mother is infected, the child will, the risk of child getting the HIV infection is only 11 to 32%. And by sexual contact, it is 0.1 to 10%. So that is very alarming. You should be very careful when you're transfusing blood.
Ma'am, I have made you as co-host, ma'am. Can try sharing. Ma'am, am I audible?
Yes, you are audible. 2 minutes. I'm just sharing my PPT.
Okay, ma'am. Okay. Or shall I share from my side?
No, it's coming.
Okay.
Thank you.
Screen is visible, ma'am.
Screen is visible? Okay, thank you. Sorry for the inconvenience.
Oh, that's okay, ma'am.
So we were talking about the safe blood, availability of safe blood. So blood safety can be ensured by three important different means. One is proper selection of blood donors. The other is the laboratory testing for HIV, hepatitis C, hepatitis B, and syphilis, and also malaria. We test for 5 mandatory infections, and also by pre-transfusion testing procedure, which we ensure that we give properly matched blood. So as you can see, thank you. Laboratory testing for HIV, hepatitis, and various other diseases, it is not 100% safe. Whatever test we do, it is not 100% because we have the window period or the incubation period where the infections cannot be picked up by any of the sensitive screening tests. So that is the thing which you have to keep in mind. So that is why we concentrate more on donor selection. If we select the donors properly with all the necessary criteria and by taking good history and deferring the donors at risk of transmitting the diseases, we can ensure 100% safe blood. So that is why we are mainly concentrating on voluntary donors who come up with good habits and they are sure that they don't have any kind of infection. So types of donors, as you can see, we have voluntary non-remunerated blood donors, we have family donors, family or replacement donors, and we also have autologous blood donors. So voluntary non-remunerated are the safest blood donors who come forward to donate blood without any expectations. That is, they don't expect any kind of remuneration or money or any other kind of offerings for donating blood. They just want to donate blood to help the mankind, to help the patients who are in need. And voluntary donors, again, they come forward. They can be a new voluntary donors as we are motivating you, giving awareness. You all come forward. So you'll be the new voluntary blood donor. We have lapsed voluntary donor. That means you come forward, you donate once, or you want to wait for a camp and donate blood. So, and you forget about blood donation. So that means lapsed voluntary donor. And we have regular voluntary donor, means they give regularly every 3 months or twice in a year. So they know they have to donate the blood regularly. And again, they are the safe donors. Family and replacement donors, they come forward only to donate blood when they have a request from a family or a donor. Autologous donor means he is donating blood for himself. So why voluntary blood donation? Why WHO or NACO or all of us are stressing so much on this voluntary blood donation? That is mainly because they are the first line of defense in preventing the transmission of HIV, hepatitis virus, and any other bloodborne infections which is transmitted through blood transfusion. So I told you no screening test is 100% safe. It cannot pick up the donors if they are in window period. So that's why the voluntary donors are the first line of defense. And they have no reasons to withhold any kind of information. Like if we ask any questions related to risk, related to transfusion infection, so they don't withhold any information because they are not placed under any pressure. Like they are not coming here forcefully due to their relatives or friends. So that is why they give history properly. They are the safe donors. And voluntary blood donors, they donate blood only for personal satisfaction, and they feel self-esteem and pride to help somebody who is in need of blood. So again, why voluntary blood donation? What is the need when it comes to Karnataka? See, voluntary donors, USA and many developed countries, they are aware what is the need of blood. So they have reached 10% of voluntary blood donation. And UK again, 4%. And Karnataka, we have reached 1%. But as a whole in India, we are still less than 1%, that is 0.8%. So we need to make up this gap. And we have to see to it that at least 1% of the total population, they become voluntary blood donors. Now, what are the types of blood donation? So I don't know how many of you all have donated blood. So if we had arranged the camp, we usually come to the college and we arrange the blood donation camp where we collect the whole blood. Whole blood is the most common type of blood donation, which is again a flexible type, and you donate all the components. You can see here, you will be donating all the components of the blood, that is the red cells, white blood cells, platelets, plasma, all the component, and the amount collected is 350 to 450 ml depending upon the weight. If you are like 45 to 50 kg, we'll collect around 350. If you are more than 55 kg, we'll be collecting 450. The above, it's said that we'll be collecting only 8% of your blood. So what are the types of blood donation? Again, one is whole blood, I told you. The other important thing you should all know is the apheresis blood donation. This is the technical advancement in the transfusion medicine field. This is a fully automated instrument which is hooked up to the donor, and the donor will be donating only the necessary component, not the whole blood. If you can see here, we will be collecting whole blood from the donor, and in the machine it will separate into various components, and whichever component is needed is retained, and all other component will go back to the donor. So this is the advancement, and it benefits a lot to the donor. So benefits by donating apheresis blood donation is you will be donating only the desired component. For example, if the patient needs platelets, then you will be donating only platelets. If the patient needs plasma, you'll be donating only the plasma. And also the duration, like when compared to whole blood is 3 months for males and 4 months for females. But here it is not so. So in a year, you can donate 24 times. That is in a week, you can donate once. So that's how the interval is very short. In a span of 15 days, you can donate twice. So twice you can give your platelets. Now you can ask, when is platelets only is needed? So you all know we had dengue season. Dengue, when it was there, most of the patients were suffering from low platelet count, that is thrombocytopenia. There the patient required only platelets. That was a time we collected so many units, that is more than 200 platelets we collected from the 200 different donors, and that was given to the patient. And it helped a lot during that season, because we cannot expect regular donors to come in and give the whole blood and separate the platelets. So this is the advantage of apheresis, and also cancer patients who require platelets. Another important aspect which we saw in this pandemic was plasma donation. You all know, if the donor has recovered from COVID, he could donate his plasma because he had the necessary immunoglobulins or the antibodies in his plasma. So that is where we collected and gave to the patient who were in need. That was known as convalescent COVID plasma. So this is the benefit or the new technique which has come into the field of transfusion medicine. Now you should know the steps of blood donation. So wherever you go, you should not be in a hurry. Like, it's not only the blood donation, it's the various steps where we ensure donor safety. Like, there is registration and we do a medical health checkup, and we also counsel you like what you should know about blood donation, what are the need for the blood, and what are the care you should take after blood donation. So that's all done in the counseling aspect. And then you have blood donation, and finally you have to take rest and take some refreshment. This whole process will take about 45 to 1 hour, 45 minutes to 1 hour. But the blood donation only takes only like 8 to 10 minutes. That is the time you donate the blood. But other time you have to be like giving your history or filling the form and giving the consent. So there's common questions like if you have not donated, still you will have all these questions saying that I'm afraid of needles, I don't like them. Is it safe to donate blood because I may become weak or sick, or I may get infection? I'm not sure if I'm eligible, or I'm afraid that I'll faint. So these are the questions which raises, and then we are here to answer all your questions. It's absolutely safe to donate blood. You won't be getting any kind of infection or AIDS or HIV from donating blood. That is because we will use a sterile bag, just opened in front of you, and the needles are absolutely sterile and safe. So it is a safe procedure. You can give the blood, and we also have counselors to help you if you have any other doubts related to blood transfusion. And of course, if you are eligible or not, if it is we people who will examine you and certify that you are absolutely eligible to donate blood. So we'll do a mini physical examination to ensure that you are in a healthy condition and you can donate the blood. So we will be checking your hemoglobin. Most importantly, your hemoglobin is checked, and your temperature, blood pressure, pulse, everything is checked. And that will ensure your eligibility, not just your psychological feeling of not being eligible. And then we also do donor counseling. That is, before taking your blood, we will ask you to fill out a questionnaire. That is a donor form. Mainly those questions are related to know your habits, so that you are not at risk of giving infection to the patients. That is the importance of donor counseling and filling the questionnaire. And you have to be very prompt at this phase. And if you have any disease, or if you are taking any medications or any questions, you have to be very prompt and answer promptly. So this is the donor questionnaire which you will be filling. And here at the end, you will be giving the consent. So that is why you have to be 18 completed, because the legal age for giving consent is 18 years. So 18 completed, and then we take your consent for giving your blood and also testing your blood for HIV. For testing HIV in any collected sample, we need the consent of the patient or the donor. So the universally accepted criteria to donate blood is age 18 to 60 years. Hemoglobin, most importantly, you should maintain a hemoglobin of 12.5. That is why I say if you want to donate blood, you have to eat healthy food. You have to improve your hemoglobin, especially in females, because most of them, they'll be anemic. They won't have sufficient hemoglobin. So if you want to be a donor, if you want to donate blood, keep up your hemoglobin more than 12.5. And the pulse, blood pressure should be in the normal limits. And weight, again, you have to be more than 55, at least 50 kg, 45 to 50 kg. Most of them are underweight. Again, that's a good habit that you maintain your weight and also hemoglobin. That's how I said we'll be inculcating a good eating habit and a good culture, good lifestyle among the donors who are ready to donate blood. Again, some donors are not eligible to donate blood. So that's mainly if they are sick or not feeling well on the day of donation. Please don't donate, because you have to be very much comfortable to donate the blood, and you should not take any medications, and then you should not have so these are the deferral criteria here. So if you had blood transfusion, we defer for 6 months. If you had surgery, we defer for 12 months. Again, if you had typhoid, we will defer you for 12 months. And in case of female, if they had abortions, we will defer for 6 months. So the other important thing I just wanted to stress is tattoo, because most of the young people, they will get tattoo. If you had done tattoo, you cannot donate blood for 6 months, because tattoo is an invasive procedure. So it takes 6 months for seroconversion or the disease to pick up, if in case you have got. So that is why you are deferred for 6 months. And rabies vaccine, if you had a vaccine for dog bite, then you cannot donate for 1 year. And any history of hepatitis or jaundice in the family or close contact, please don't donate for 1 year. Again, the complications, you may feel that I'll faint. So blood donation is a safe procedure. Complications are very rare. So you need not worry about the complications. And even if it occurs, then it is easily treatable. So most common complication or the adverse events which we see in blood donors are fainting episodes, feeling dizzy, sweating. So during that time, we just relax them, give a foot end elevation and give lot of fluids. Those complications are, reactions are mainly due to low volume. You have lost 350 or 450 ml of blood. So the body needs to get adjusted to that lost volume. So that is why you will have such complication, but absolutely treatable, no worries. And other complication which might be seen as this kind of bluish discoloration at the site of needle prick. This is known as bruise. Even that is self-limiting. It will heal within 1 week or 15 days. So this is our blood bank, where there is a beautiful blood donation room. It is air conditioned. So donor care after blood donation is very important. He should be told what precautions he has to take after donating the blood. Like he has to relax for 15 minutes. He has to take refreshments, and the whole day he has to hydrate his body well. So he has to take a lot of fluids, and the bandage should not be removed immediately. Maintain that bandage for 3 to 6 hours. And then if you feel any discomfort, please contact the blood bank or the concerned person immediately. Of course, many people ask, what are the benefits of donating blood? Of course, the benefit is that satisfaction which you get by donating blood, that you are saving 3 lives. So that is the most important benefit you get. Apart from that, we do a mini physical examination. So most of the adverse health effects which are there among you can be picked up. For example, most of them are anemic. We are the ones who pick up more anemia or the low hemoglobin cases, and we counsel them to have good food, because anemia, most of the time, it's mainly nutritional anemia, because you are not giving more importance to good food or good nutrition. So that is why we give counseling to have nutritious food and improve your hemoglobin. And also some people may be showing high blood pressure. So that is where the mini health checkup is helping you to take care of your overall health. And then cardiovascular health, of course, there are many research and studies going on. It says that if you donate blood, you will be losing more of bad cholesterols, and also the iron content of your body reduces. That's why the donors will have less chances of heart attack or stroke. Of course, the blood pressure also will be maintained to some extent. And most importantly, the blood donors provide a vital service to the community. This is again important. Whenever you are donating something, giving something, you give with happiness. And this social service matters a lot. You will feel happy, you will feel satisfied. So that feeling cannot be given by any other donation. Then a lot of questions like, what happens after blood donation? Where is my blood going? What are the process they do? So when you donate your blood, depending on the type of blood donation, what we do is, first is, if you are giving your whole blood, then we will separate the components. So various components in the whole blood are separated by various technology. We have a high-end instruments, we have trained technical staff, and also the instrument to store the components at that particular temperature, so that the all the components are optimally functioning. So component therapy, you should be knowing, there is no more whole blood transfusion. As you can see, If only in the rural areas where there is no good instrumentation, no technical staff to separate the blood component, they rely on whole blood. But otherwise, we are all now giving only the specific blood components. Transfusion of specific blood component instead of whole blood is known as component therapy. Again, why components? Why you want to do so much of extra work to separate the component and give the each component? That's mainly because the blood is a precious resource and we have to make optimal use of the available resource. That's the main intention. So if you give blood, we will separate the component and give to different patient. By doing so, we are avoiding unnecessary and harmful components to be transfused to the patient. So as you can see, if you donate whole blood, we are separating into the component like red cells, fresh frozen plasma, platelets, and cryo, and then they are stored at that particular temperature where it is optimally function. Like for red cells, PRBCs are stored for 35 to 42 days, plasma is stored for 1 year, and platelets for 5 days. By seeing this, now you know why they say by donating blood, you can save 3 to 4 lives. This is the actual meaning of when you, the slogan or the point when you say donate blood and save 3 to 4 lives. So, again, after separating it to the component, we will test the blood for the various infections, that is known as infection testing, and we will ensure that the infection is not present. At least 99.99%. We use sensitive methods to screen the donated blood. We have ELISA method, and now if you want an extra coverage, we also have nucleic acid testing. Of course, it will add to the cost, but that will extra safety because the window period is shortened. Nucleic acid testing will detect the disease earlier when compared to ELISA. So quality control is done. So that is why we charge. So many of them might ask you again, like you are into medical field. So they will ask you why they are charging for blood. I have donated blood, but still they are charging. So you should be knowing the answer. See, what if they have donated blood, we are just not taking that blood and directly giving to the patient. Like what we see in the movies, you donate blood and the blood directly goes to the patient. That is not the actual scenario. So what happens when we collect the blood, we are handling it, we are testing it for various infections, we are storing it and then giving. So that is why government has fixed the processing charges. Whatever money is collected is mainly for the processing charges of the blood unit. So this is fixed by the government. It is not like fancy rates. We cannot charge whatever we want. It is fixed by the government for the government hospital and for the private hospital, and accordingly we charge for the blood. Another important question is where to donate blood. So you can donate anywhere, wherever you are there in your hometown, but you have to make sure it's a licensed blood bank having good facilities. So this is our JSS hospital, which is having a huge blood bank, big blood bank in Mysore. So we have a spacious waiting area with reception, donor selection area, bleeding area, and then we also have apheresis license and apheresis room. One is this, the other is you can donate in the blood donation camps. So every time we go to various institutions and we conduct camp, we give awareness, we also conduct the camp, and it's a part of NSS activity. So there also you can donate blood, but for that you need not wait every year for the camps to happen and donate blood. You can go to any blood bank, donate every 3 months and be a regular voluntary blood donor. And the newer invention is the mobile van. So there are many mobile vans which goes and collects the blood. It is having all the necessary instruments inside the van so that it makes the donor comfortable. So that is about where to donate. Next, coming to who needs the blood. So you all know very well who are the patients who need the blood. You know, surgical patients, pregnant and childbirth, like if they are anemic, they need the blood. Anemia, again, it's a very common medical condition where we give blood transfusion. And thalassemia and hemophilia patients, where they regularly get blood transfusion throughout their life. So this is where the blood transfusion is helping them to improve the quality of life. And cancer patients, because they are taking chemotherapy and they require support by blood transfusion. Dialysis patient and road traffic patients. So this is thalassemia patients. Our institution is giving blood for more than 60 to 70 thalassemia patients regularly. They come every month for blood donation. And what you have to see here is, see, they are thalassemia patients. They cannot maintain. So they need blood transfusion every month. If they don't get transfusion, then they will end up in the complications. So they will have severe anemia, they will have cardiac failure, and they cannot sustain their life without blood transfusion. So thalassemia kid, they request everyone to give blood because they can sustain their life. So there's a lot of challenges in giving blood to the thalassemia patients. Since they require repeated blood transfusion every 24 to 30 days, they should be given with fresh blood units. Fresh means within 10 days old. So that is where they require regular blood to be given so that we can give them fresh blood. And also rare blood groups. Every one of you should know your blood group. And if you are negative, that is O negative, AB negative, B negative, or A negative, then you have to enroll your names in the blood bank so that if the blood is needed, they can call you. That is very important. So dialysis patient, again, they need blood. Cancer patients, emergencies, we have casualty and emergency department. If a patient comes with road traffic accident, he will need more than 10 units of blood to be transfused. So that is known as massive transfusion, where they can have n number of transfusions. So there also the blood is very much needed. So that was about the need of the blood, who can donate blood, what care has to be taken after blood donation. Now, just to relieve your fear, blood donation during COVID-19. Now we are going through very bad situation like COVID-19 pandemic. You all are at home and no regular schools, colleges, institutions. So blood, there's a lot of shortage for blood. What you should understand at this time is there is no risk of getting COVID-19 by blood donation. If you go to a blood bank and donate blood, you will not get COVID. So that is ruled out. And other important thing is there is no reported or suspected case of transfusion transmitted COVID-19. That is, if I give a blood, the patient will not get COVID from blood transfusion. That is also ruled out. And again, of course, we are short of blood. You may think patients are not there, there is no regular admissions, no regular surgeries, then why? But you should remember there are regular patients who are coming in, cancer patients, trauma patients, thalassemia patients, all of them are coming in regularly. So they need blood. So that is why blood donation has to go on. It cannot stop in the pandemic situation. And few again queries like I'm having COVID, can I donate? My mother had COVID, can I donate? So these are the questions you should know. See, we have certain safety issues, that is deferral criteria for post-COVID infected donors. So if you are a confirmed donor, confirmed case of COVID-19, then you cannot donate for 28 days after the discharge from the hospital. So that you have to remember. You should be completely completely cured of your COVID-19 symptoms. 28 days after you can donate blood. If you have any contact history, please don't donate for 28 days. And again, travel history, you all know 28 days deferral. And other recent thing is post-vaccination. When can I donate blood if I'm vaccinated? That is after 14 days. It is not 45 days. It is not 28 days. It is 14 days. On 15th day, you can come and donate the blood. That is one clarification should be to be made. Of course, during this COVID pandemic, there's a lot of guidelines followed so that we were not spreading COVID. So we maintain social distancing measures, infection control measures, all those things. We have hand sanitizer placed everywhere, thorough donor screening so that there is no transmission of the disease. You can see here, during COVID, we maintain social distancing and all our sisters maintain wore PPE like gloves, mask, everything was worn, and we took the blood carefully. And then post-donation care, like in case we counsel the donor, if after giving the blood, if you go back and if you get COVID, please inform us immediately so that we can take necessary actions. And the related blood unit which we collected, if they inform us that they were positive, and that will be discarded. Though there is no risk of transmitting the infection, but still for safety issues, we discard the blood. So that was about blood donation during COVID pandemic. So this is just how we celebrated World Blood Donor Day. If this was not the pandemic situation, we usually celebrate it by felicitating the regular blood donors. 3 blood donors are regularly felicitated, and we give a lot of awareness program. There used to be Jata rally related to awareness program, and poster competition used to happen. And then this is a poster which was made and won the prize. So that is the kind of awareness we give during World Blood Donor Day. And we also conduct various awareness program through NCC, and also blood donation camps used to conduct. Of course, we used to come to Ayurveda also every year. And this is my team, my technical team, my nursing team, and the medical staff of JSS Hospital Blood Center. So blood donation will save someone's life. Thank you. This is the JSS Hospital. Any questions?
Thank you, ma'am, for enlightening us. So the session is open for discussion. If you have any doubts, you can just ask. Ma'am, we have received few questions. So shall we? I'll just, we can discuss on that, and then later if we have other questions, we'll take on, ma'am.
Yes, please.
Ma'am, the question is, like, you have said that 28th day after the getting COVID and recovering or home isolation, we can donate the blood. But whether there is any test that we need to take, because today what we are seeing is in the second wave that even after 1 month, 2 months, the RT-PCR is coming positive.
Yes.
What are the guidelines for that?
Actually, according to the guidelines, after 28 days, we need not do RT-PCR. Because if RT-PCR, even if it comes positive, it may be a dead virus. So there is no transmission of infection as such after 28 days. There is no rule to say that you have to get RT-PCR done and get a negative report. For us, we are not doing that. And the guidelines also says the same. No need for negative report.
Okay, ma'am. Thank you. And the next question is, ma'am, do we have any public platform wherein a public can get the information regarding the availability of blood in different blood banks? Because what happens if any surgery is going on or if emergency is needed? Yeah, ma'am.
No. That's not the thing. Like, we have a public platform where we put in all the stock availability every day. Like, we have Jeevan and Jeevani. That's the government opened website. If you go through, you can see how many units are available in each blood bank. It's a mandatory aspect which has come from drug controller. So every day morning, whatever stock is available, we will upload it online, so that even if a person is in some other hospital and requiring the blood, he can go through that website, and whichever unit blood is available, he can approach that particular blood bank. Hello. So that is the public platform which.
Yeah, thank you, ma'am. Ma'am, as in the first year when students join, they are hearing more about this Bombay blood group. Okay. So can you just throw some light on that, ma'am?
Yeah. Bombay blood group is nothing but a group where they don't have any kind of antigens. Like if you go through the ABO antigen, each of you will have either A antigen, B antigen, or AB antigen, or none of the antigens. Like if you don't have A and B antigen, you are grouped as O group. So if a O group donor doesn't have a precursor antigen, that is H antigen, then he becomes a Bombay blood group. The problem with this is he will develop all kind of antibodies against A, antibodies against B antigen, antibodies against H antigen. So none of the regular blood donors can give blood to him. So it is only Bombay blood donor who can give blood to the Bombay group patient. So that is the importance of knowing the Bombay blood group. So whenever you go and get your blood tested, if they tell you O group, we will confirm whether you are Bombay blood group or the regular group. So that is mandatory. I think everybody will check it and we will give the report.
Whether such incidents you have come through in Mysore, ma'am?
Yeah. Actually, here we have. So we recently had a pregnant lady who was due for delivery, and then we have a list of Bombay blood group donors. We have around 5 to 6 donors list. We call them and they respond to our call. They came and they donated the blood. We kept the blood ready for the delivery, but she didn't need blood for the delivery. It went on well. What we do is, once we collect the Bombay blood group, we will not waste it. We'll put up in the website. We will contact all the blood banks throughout the country, like other state also. We will ship it. I mean, we'll send it by courier, so that blood is not wasted. So all the blood banks are connected in relation to the Bombay blood group.
Thank you, ma'am. Any more questions, students?
And all the first years should get their blood grouping done on the mandatory basis. And among you people, like if it is the strength of 100, you should know how many are negative, because the negative group donors are very precious. And that data should be shared with the blood bank so that when the need arises, we can contact you.
Yes, ma'am. Actually, we have maintained the logbook.
Yes.
Whenever the students come and we see their blood group and we maintain the records. Thank you, ma'am. Any other questions? Now I call upon Dr. Shashabindu sir, NSS officer, assistant professor, Department of Agada Tantra, to render the vote of thanks.
Good afternoon all. Pranams to His Holiness. Donate your blood for a reason. Let the reason to be life. With this quote, it's my proud pleasure to propose vote of thanks on this occasion of Blood Donation Day. It's my great privilege to thank today's guest speaker, Dr. PALLAVI P, Associate Professor, Division of Transfusion Medicine, and as well as the Blood Bank Officer of JSS Medical College and Hospital, Mysore. Thank you, ma'am, for throwing a light on us regarding the importance of blood donation, and which was watched by more than 250 students and staff of our college. Thank you, madam. So I will extend my thanks to our ever supportive beloved principal, Dr. Sarveshwar sir, for giving an opportunity to organize this event. Thank you, sir. I would like to thank Dr. Rajesh Putpudi, Dean, JSS Ayurveda Medical College, for his presence. And I would like to thank today's organizing team, Dr. Subhash Chandra Bose, Professor and HOD, Department of Roganidana, and his department team, Dr. Savita Hiremat, Professor and HOD, Department of Kriya Sharira, and the department team, and as well as the NSS unit of JSS Ayurveda Medical College, for organizing this event very smoothly and successfully. Thank you, our organizing team. Finally, I would like to thank all the teaching and staff and the students for attending and supporting this valuable program and making this event a grand success. So finally, I conclude by quoting this theme: give blood and keep the world beating. And finally, another important thing what I have noticed in today's newspaper. So due to this COVID pandemic, 60 to 70% of the blood donors have been reduced, and it is the need of blood donation, okay, because to keep up the blood in the blood bank, okay. And I request from the NSS unit all to donate your blood. Okay, thank you one and all. Thank you, madam.
Thank you. Can I exit?